Healing Our Village presents
COVID Conversations.
Where does she get her information from? Do you watch TV with her? Or
all of these things that we
Learn
find
about
in
staying
African Americans increase your susceptibility to getting the virus, especially this more contagious
Determine
Delta
the facts.
Right now, in hospitals throughout the country, but most certainly in
Hear
the
from
South.
the community.
what happens if it's positive? So you do not want to take the risk.
You need to ask those questions.
Like, what made you come?
Because I want to get vaccinated so me and my family won't have COVID.
Hi, this is Dr. Lenore Coleman coming to you today for Your Health. As you know, on Saturdays we're here. It's actually a blue sky day. I'm very excited about that here in Jonesboro, Georgia. And we are coming to you with COVID Conversations. I try to do these as much as I can live. Sometimes we do pre-record them. But today I'm here live in studio with Vaughn Thomas from Columbus, Ohio. And he just came over to visit, and you know, when anybody comes into my building here in Jonesboro, we have to have a COVID conversation. So thank you so much for coming today to the show. I wanted them to sort of get your perspective of what's happening in Columbus, right, with COVID, and just some of your experiences. So why don't you first introduce yourself to our audience?
Greetings, everyone. My name is Vaughn Thomas. I am originally from Columbus, Ohio. My wife and I, we just moved back to the States, United States from Japan. We were on a 3-year overseas tour. I've been working for the federal government. I work in human resources for the federal government. I have over 37 years of experience working for the federal government in human resources in HR, various capacities. And currently right now I'm working in Columbus, Ohio.
Okay, all right, good. So we were talking before we started today just about your perspective on COVID. So, you know, in Columbus, where do you think we are? Do you feel like maybe we're turning the corner? Is there still a lot of anxiety in Columbus in terms of COVID infections? How's your hospital rate going? All of that kind of stuff. Where are we at?
Well, I know, the hospital rates have been going down.
Yes.
Because now we have gotten to the point in Columbus where masks are optional in a lot of places and so forth. But me personally, I still wear my mask. And what you find, like for instance, I work for the federal government. We've been teleworking working from home I've been back in the States over a year now. So since I came back, we've been teleworking from home. So we don't even go into the office. A lot of things, you know, we do, through team meetings and so forth, through the internet and so forth. But for the most part, there's a lot of misinformation out there because in one instance, I was working with my younger cousin trying to get her employment, and part of the process of working for the federal government is you have to get a shot.
Yeah.
And so she filled out her application. I was talking to her, and all of a sudden I didn't hear from her, and I contacted her and I said, well, what's wrong? She said, well, I'm not going to get the shot. And I'm like, why? She said, because it will make her sterile.
Wow.
Yeah. And so that there's a lot of misinformation out there, particularly in our young African American community in terms of what they hear, through Facebook or their friends and so forth. But the thing that really blew my mind is that she couldn't get the COVID shot, but she can go get her tongue pierced.
Right. Yeah, she went and got a tongue piercing. Yeah, what's really interesting, and so that's one of those myths out there, folks. So the shot does not make you sterile. In fact, there's a whole lot of folks pregnant right now, okay, who got their shot, and they are about to deliver babies, okay? So, in fact, there are even people who are pregnant who have gotten the shot. So that is totally a myth. That is not true. It does not affect the sterility of men or women. And so, you got to come up with another reason. That can't be the reason. I've heard all sorts of things. It came too fast. They didn't do it. It took too long. They didn't take enough time to research it thoroughly. We don't trust the government. I had a veteran a week ago. I was doing a veterans health fair, and she didn't want to. She didn't want to get the vaccination because she didn't trust the government. But these vaccinations were not made by the government. They were subsidized by the government in terms of the research. But they were not made by the government. The Moderna is the one you said that you had,
yes, ma'am.
Which is the one that I had as well. It was actually developed by NIH by an African-American woman. Okay, her name is Kizmia. All right, this woman, all right, has been spent her whole life, every day, focused on viruses, immunology, all of the things you need to know to come up with vaccines. She spent her whole life doing that. So when the Chinese put the actual formula up on the website, right, on the internet, so that people could see what this coronavirus actually looked like, within 72 hours, she had the vaccine at NIH. Because she was ready. All she had to do was see the sequencing, right? The DNA sequencing of this particular virus. So, you know, folks, all of these myths are just not true. You said something when we were talking earlier that was interesting. So when the vaccine first came out, what made you specifically take it? Why did you decide it was a good idea?
Well, for me, at the time we were living in Japan in 2019, and right before it actually exploded, my wife and I and a group of friends, we were about to take a cruise. And so we were going to fly from the military base we were on is like maybe 45 minutes from Tokyo. So we was going to catch the train to Tokyo and fly from Tokyo to Singapore.
Okay.
Okay, and then from Singapore, we're going to do a 9-day cruise, you know, going through Bangkok, 4 stops in Vietnam. And that morning of the cruise, I'm literally zipping up my bag, right? And my wife is at work, and I'm like, okay, I got to meet her to get on the bus. All of a sudden, I get a text from the cruise line, right? So I'm thinking it's like, hey, you're about to embark on the time of your life, prepare for this and that. It said, due to COVID in the region, your cruise is being canceled.
Wow. Wow.
So they literally canceled the cruise. And then also in Japan, they weren't letting cruise ships come into the harbor. No. So they were basically making them stay out until they cleared quarantine. Yes. So for me, seeing that, then also just the whole process that the Japanese government, there was no issue with folks wearing masks or like what's against my constitutional right or this or that. Yeah. They were more compliant because their concept is, even before COVID hit, Japanese wear masks when they're sick. Right. Because they feel that, hey, I'm protecting you from me because of my sickness. I don't want to spread my illness. And plus, due to the volume of people who use their mass transportation, that you can really spread it just in a short period of time.
Yeah, they're in pretty close living conditions.
Oh, well, like exactly where we live, this lot that your building is on, this would be probably 10 houses.
Okay, exactly.
You know, 10 houses in terms of, just like you're saying, the density. Proximity. Your density is very low density. So just experiencing that. And then when I came home to the States to take care of some business, I got off the plane and just walked right through the airport and got in my car and went home.
Okay.
When I went back to Japan, I had to go through a quarantine process.
Oh, wow.
Even before I could
really let people in, didn't we?
Right. Before I could even get off the plane, they tested me.
They tested
before they let me go out into the general public.
Yeah. Yeah. Japan, I remember, I think reading that they did a really good job at getting everybody vaccinated, keeping the rate down because everybody was masking and hand washing. So as opposed to some of the other, you know, Asian countries like China, for instance, right? They're still having trouble in China. Yeah. So Japan did a very good job. So if you had to pick a place to be, I think it was a good place to be.
At the time it was, but the only sad part was for us was we were going to be there for the Olympics, the 2020 Olympics, and then the Olympics got canceled or postponed. I shouldn't say canceled, we got postponed a year later. Well, I left 6 months before the Olympics actually took place, but the way they had it set up, I wouldn't have been able to go anyway.
Yeah, that's right.
So I didn't, you know, wasn't too frustrated. But also that was very interesting or unique. As we left Yokota Air Force Base, my younger cousin, she went to Yokota Air Force Base to work for DFAS as an accountant. Okay. So just talking with her, like for instance, we used to be put on lockdown, meaning that we could not leave the base. So that everything, because basically if you lived on a military base, you know, you basically serve service, you got your commissaries and everything you need, everything's there. We can only go out into the local community if it was for necessities.
Okay, all right. So no, they really did a great job. So I mean, you said something else that I I just want to talk about a little bit. You said that in Japan, just if you have a common cold, they wear a mask, right?
Correct. Yes, ma'am.
Because they care about not infecting you.
Correct.
Whereas here in the United States, that is not happening. And not even in the African American community, which in my experience of being here, and I've been here almost 70 years, people really used to care about infecting their families or care about what happened to people that they love. But I'm not seeing that now. Why do you think that is? Do you have any opinions on that?
I just think now it's just a different generation. There's so much information out there now that people are getting bombarded with information, but they don't do the research to validate the source, where that source is coming from. Just like, for instance, my cousin, when she's talking about the vaccination will make her sterile, I'm like, where did you hear that from? Where did you read that? What journal? But they can't give you the source, Well, I heard it from a friend. But I also think it's just more of the younger group in terms of just the lifestyles. Like you said, we're probably in the same generation, baby boomers.
Yeah, baby boomers.
So being in that generation, we just came up. We went to school, we got vaccinated, got to get shots and so forth.
We didn't worry about vaccinations.
Polio, measles,
But
mumps.
I think, at this, not to cut you off, but I think that what I'm seeing is there's a lot less family cohesion. So, back in my day, we used to always gather on Sunday for Sunday dinner. Right? I was really involved in the church. There wasn't no discussion with my mom, are you going to Sunday school? I didn't get to debate that with her. I had to go. So, there was a lot more family. I knew my grandmother and my aunt, and I saw them regularly, right? Because they lived in my area where I lived. So I think maybe it's because we're all spread out. Maybe there's less family cohesion. I'm not sure, but I know in the Japanese culture and the Chinese culture, the Korean culture, there is a really huge sense of family and family cohesion.
I agree, because it's more of extended family. I think as African Americans, we lost that extended family value or lifestyle in terms of just trying to, which I call sometimes assimilate. One of my theories I truly believed in, the demise of the Black community was, in my opinion, was integration. Because we lost all of our stores, all of our shops, all of our doctors and so forth in our communities. And so then what happened to our community, the haves left to leave the have-nots. And then that's where the deterioration came to our community. But I really just think it's just, as you were saying, that we just don't have that extended family no more.
Yeah, I agree. So as we move forward, you're here, visiting here in Georgia, in Ohio. There's supposed to be a new variant coming. I don't know. We'll see. But one thing I want the audience to know is that there is it's on the internet, so you can validate this. As of Monday, all of the testing is not going to be free for the uninsured. All the vaccinations are not going to be free anymore for the uninsured. So you have to have health insurance or pay cash out of pocket. So I've been warning people for the last, 6 months that the government was not going to be able to continue to foot the bill. I told everybody that. So your window to be able to get this stuff done, especially the vaccinations, is you better hurry up today and tomorrow and get it done if you don't have health insurance, because in a minute, unless there's a certain community-based organization or a nonprofit, and we don't know how it's all going to, filter out, but you're not going to be able to get the vaccine for free and the testing for free.
And that's why you have to pay for each shot, not just the first, the second. It's not lumped together, but that's each shot. And I just saw it on the news the other day, Moderna's possibly coming out with a third shot.
Yeah, exactly. So here at Healing Our Village, we actually do have the rapid tests. And so we are doing the rapid test, the antigen test. The one that we have here is very accurate. And we're only going to charge $10 for a COVID test. If you were to buy them off of Amazon or whatever, it's going to cost you around $14, $15. So we are discounting it. So here we are in Jonesboro, Georgia. So for any of those folks here in the south side of Atlanta, right? Riverside, Riverdale, Monroe, Stockbridge, etc. I think that you should come on over. My people will actually do the test for you, so you don't have to figure it out, right? So, so that's going to be the low-cost option for testing, and I don't know what we're going to do about the vaccinations for the uninsured. I'm still trying to figure that out. I'm actually received a HRSA grant to do education. So I hear a lot about things. So I will let you all know if there's going to be options out there for you. But that's big. That starts on Monday.
Wow. That's going to be
big.
Devastating.
Yes,
devastating.
It's going to be devastating. And a lot of the people who don't have a lot of money were one of the biggest folks who didn't want to get the vaccine.
That's true. And that's the misfortune that our less fortunate don't have the facilities or the resources, but also at the same time, we don't do a better job of getting them to those resources to help them. But also, there's the two-way street.
Yeah.
That has to be, and you have to come together and meet on them streets, because a lot of times we're going like this.
Yeah, we're in opposite directions.
You know, we're spinning our wheels to get it, to help our community, but also at the same time, we're having folks who don't believe, or they'll come up with some reason or excuse not to. And really, we are a group of people, we are all different in our communities, but we have a common interest.
Yeah, we do.
And that's our health.
Yeah, and you know, my hashtag is no more funerals. Hashtag no more funerals. I'm right down the street from a funeral parlor, and every day I come to work, every other day there's a funeral. And this is mostly African. I live in an African American community. I live in Clayton County, 85% African American. And they are dying of heart attacks, they are dying of strokes, they are dying of kidney disease. And that is mainly because of high blood pressure. And I do health fairs. We just did a health fair for a veterans group, and we only had about 20 people come through on a Saturday. So we have our health fairs posted up on our website. Please, you all that live in this area, please come to our health fairs. They're free. We can test your blood sugar, your blood pressure, all of that for you. Our next health fair that we're going to be at is on April the 9th. It's with Dumont Davis, the councilman, and it's going to be at Lake Spivey. There's going to be all sorts of people there doing all sorts of health and wellness programs. We'll be there doing blood pressure, blood sugars, height, weight, all the stuff that we do. Bring your medicines. We'll have pharmacists there to talk to you about your medications. We're here to provide this service. We have something called Village Club. It's on my website, which is HOVhealth.com. $5 a month. $5 a month. And you get all of my services. My dietitians, my pharmacists, my doctors, everything, all of my videos, everything that we have to offer. Yeah?
It's great. I mean, really need to take advantage of the opportunity.
You got to take advantage of that. So that's why, I don't go to funerals. I don't go to funerals unless somebody is over 70 and have cancer. Then I go to the funeral. But if you're dying of blood pressure, heart disease, diabetes before your time, shame on you. Shame on you. Because there's no reason for anyone to be having a heart attack and stroke in 2022. Seriously. Because the main reason for that is high blood pressure, especially in the African American community, and diabetes out of control. And we're here to help you with that. So I really appreciate you dropping by, right? Right?
Yes,
anybody out there who wants to just come on by on a Saturday and have a COVID conversation, you can give us an 800 number, 800-788-0941. Give us a call. We're here Monday through Friday, and we'll sign you up. You can come into the studio and have a COVID conversation. Thanks a lot for tuning in today on For Your Health, and thanks a lot for coming by.
Thank you. Enjoyed it.
TLC needs your generous support to bring our outreach program to your community. Your generous support makes it possible for Total Lifestyle Change to provide our educational workshops, our health fairs, our cooking demonstrations, and our church-based program to underserved communities nationwide. To donate to TLC, go to tlc-global.org. Please consider making a tax-deductible donation today in any amount that you would like. For more information, contact Dr. Lenore Coleman, President and Founder of Total Lifestyle Change, at drcoleman@healingourvillage.com. Thank you so much.